for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na minatapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung maa-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titinan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung siyempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Daw itong yung PPARS. Pangalawang gabi, naman ako parang iba. May langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, gano'n. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Healthy day, everyone. My name is Jhen, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. We are an international distributor of food supplements made from a unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. Now, whether you are a patient, caregiver, or someone supporting a loved one through their cancer journey, tonight is for you. Because our topic is finding hope in the middle of your cancer treatment with simple yet practical ways to support your body in the middle of surgery. Just a quick few notes. This session is live streamed on Facebook and simulcasted on YouTube. And yes, it's being recorded so you can replay it or share it with your loved ones afterwards. Also, there will be a Q&A segment at the end of the talk. So keep your questions ready and type them in the chat anytime. And while you're grabbing a notebook, if you'd like to take notes, let me call on a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore, Mr. Shyan Lim. Good evening po, Sir Shyan.
Hey, good evening, Jen, and good evening to everybody. Here in the Philippines, we just finished celebrating Good Friday, Holy Week, and Resurrection Sunday. So we are so glad to be back here on the program again. But we were actually on last Thursday. So tonight, we're going to talk about how to keep going and finding hope in the middle. How shall we say? Challenging news to receive, and it's not easy to keep on keeping on. But tonight, we'll share some tips, and more importantly, we will also be having our Ask Me Anything segment where you can actually ask questions, get answers, and grab onto that hope that we all need so that we can move forward to a healthier 2025. Okay, I'll turn the time back to Jen, and I'll see the rest of you in a while during our Ask Me Anything segment.
Yes. Later, during our Ask Me Anything segment, we'll be joined with the expertise and insights from Dr. Jansen Kalalan, a graduate of St. Luke's College of Medicine, a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. But for now, let's all watch this.
Good day, everyone. I'm Shan, and you're watching another episode of Simply Healed webinar. If you or someone close to you is facing cancer, you may feel everything is out of your hands, that all you can do is follow treatment and hope for the best. But let me share something important today. Even in the middle of cancer, your body is still working. It's adjusting, protecting, trying its best to keep you going. So the question is, are there simple ways to support your body during this time? Today, I will introduce some practical ideas that many people haven't been told. They are not about replacing medical treatment, but about supporting your body to stay stronger, feel better, and be more resilient throughout the journey. We're going to do this in 3 steps. I will share with you 3 important areas you can focus on even during chemotherapy or radiation therapy. So that's really important, right? To help your body function better. Okay, I speak to many patients undergoing chemotherapy and radiation therapy. So the feedback from patients differs from patient to patient. There are many patients who tell me, the oncologists tell them, don't do anything, just go through the chemotherapy and you will be fine. And then there are other oncologists who tell them to exercise to keep their body strong. Some oncologists even suggest and encourage their patients to go to the cancer center in their hospital where they actually have nutritionists, right, and other specialists who will support them through this entire cancer care. In general, the move towards cancer in the treatment of cancer today is actually to be not as invasive as possible. I had a conversation with the head of one of the top hospitals here in Philippines, and he's the head of the cancer center. And he's saying that the last conference he went to was actually talking about using less chemotherapy, trying to use as little as possible, and also supporting the patients through different disciplines. That means through different medical specializations, and including people like nutritionists, supplementation, lifestyle adjustment, to make the entire journey not only more effective, but also more comfortable for the patient. The first one we're going to cover today is your immune system support. All right, your immune system needs support. Cancer treatment can take a toll on the immune system, but your immune system is still trying to do its job. So fighting off other infections, not just your cancer, repairing tissue, and maintaining balance. Many people don't realize that certain natural supports, including specific plant nutrients, can assist in the immune system without interfering with treatment. That's the key word, right? Because you're undergoing chemotherapy. Some compounds, like those found in microalgae, are gentle and natural and can be used alongside standard care in some countries. Curious about how that works? Jot that down. We'll talk more about it during the Q&A or Ask Me Anything segment. But just a quick footnote. When you are undergoing chemotherapy or radiation therapy, some oncologists and some doctors will highlight don't take supplements, while others will encourage you to take supplements. So it really differs from doctor to doctor. But there is something they all have in common. All oncologists will tell you to eat well, to take the right nutritious foods. So here's where Simply Nature PPARS really is very different. Simply Nature PPARS is actually a food rather than a supplement. How is that the case? Well, you take a look at your multivitamins that you find in the health food store that you buy all these things from. You look at the ingredients, they are formulated. You can't really say it is food in the sense that it contains some preservatives, it contains binders, so on and so forth. How is Simply Nature PPARS actually food? Because the Simply Nature PPAR tablets is actually just algae. We spray dry it so it becomes powder, and then we press it into tablets. So it's like you're eating algae. It's like you're eating, those of you who like Korean food, they are eating that seaweed, or if you like Japanese food, it's like that seaweed that wraps your sushi. But of course, the issue with algae is it's not a taste all of us like. So what we did is make it into a powder. Nothing was added, nothing was removed, and then we press it in. So that's why Simply Nature PPARS is not really supplement per se, the same way you will see a vitamin C or vitamin D or vitamin E supplement. Is actually food. And because of that, we are confident that it will not contradict, will not have any contraindications with your chemotherapy and your radiation therapy. So all oncologists and doctors would actually stand by you, because eating Simply Nature PPAR tablets is eating food. Okay, let's move on to the next topic. Inflammation. Inflammation can make things worse. Fatigue, discomfort, and slow recovery are often linked to high inflammation. It's like your body is always on fire inside, and that drains your energy. Simple steps like drinking more water, managing stress, and avoiding processed food can help. Some also turn to plant-based anti-inflammatory support. So this is really important, right? Inflammation is the root cause of many things. And in your chemotherapy and in your radiation therapy, because there is damage done to the tumor and also your healthy cells, every time there's damage done, inflammation is created. Why? Inflammation is your body's response of sending blood to the area. That's why it's inflamed, right? Why does the body do that? Because the blood carries all the nutrients and the repair components, the different enzymes, minerals, hormones that your body needs to repair the damage. So every time there's damage in the body, there's going to be inflammation. And of course, chemotherapy is like, World War II, where they dropped many bombs on the city, so that you can imagine there's a lot of damage happening, and that's why inflammation is really high when you're undergoing cancer treatment. So these steps will help you reduce inflammation. Maybe you're wondering what's safe and what's not. Great question. Ask us during the Ask Me Anything segment. Last but not least, our third tip for today. Cells need the right conditions to function. When your body is under stress, it focuses on survival. When your body's under stress, like you're undergoing chemotherapy, radiation therapy, you're fighting cancer, what are the things first to go? Right? Your hair. Your hair drops, your fingernail doesn't grow as fast as anymore because all the energy is reserved for your core functions, and all the extremities like hair growth and nails, which are less important, actually is put on the back burner, right? So that is why your body actually prioritizes how it uses its energy. So taking care at a cellular level is really important. So your body focuses on survival. Now, what are the ways you can support your cells so that they can do their job more efficiently? Like clearing out waste, processing nutrients, and staying balanced. This is where cellular support comes in. Some compounds like that activate PPARS, like our product, work quietly in the background, but they work at a level that is so integral, your cells. And the effect can be rather quick. In fact, if you're using our liquid extract, we have cancer patients who are bedridden, not able to get up at all. Many are just basically sleeping, especially for late-stage cancers that have metastasized all over their body. Yet on our Simply Nature liquid, as fast as 72 hours or of 3 to 4 days, they can actually be sitting up, right? And in less than a week, they're actually walking with assistance, all right, walking and being able to do simple physical activities. Now, this does not mean their cancer is reversed, but this definitely means quality of life is improved. And it is a good indication that the body is more energetic, it is in a better position to fight cancer. So we started this program talking about how you can go through your cancer treatment while you're in the midst of the cancer treatment, how you can take care of yourself. It is a very important thing to do because you need to make sure that your body is recovering from the effects of chemotherapy and is ready for the next session. The chemotherapy will do the job of destroying the cancer tumor cells, but you have the responsibility of making sure that you repair your body and maintain it through the whole entire process. Okay, before we end and move to our Ask Me Anything segment, a quick recap. During this entire journey while you're undergoing chemotherapy and radiation therapy, remember, you got to strengthen and support your immune system. Number 2, you got to manage inflammation. And last but not least, you got to nourish and build your body at the cellular level because the damage, especially for radiation therapy, is actually at the cellular level. So without further ado, we're going to move into AMA. Just in case those of you who are in remission, the 3 tips are also applicable to you. And in fact, in the near future, we're going to do a special episode for those of you who are in remission. But right now, I see the questions coming in, so let's go to our Ask Me Anything segment.
We believe in the power of informed choices and also in the potential of natural therapies that support your immune system and overall well-being. I know you must have lots of questions, so now it's time for our much-awaited live AMA or Ask Me Anything portion. Drop your questions in the comment section and we will try to answer as many as we can. But before we begin, let's just give a big shout out to our loyal viewers, Ms. Elena Robles Antonio, Mavs Agot, and Edna Alarcon. Also, a special welcome to... Now I can see lots of questions coming in, so let me call on our 2 esteemed experts, Mr. Shyan Lim and Doc Jansen.
Good evening, Jhen.
Evening.
And good evening, Doc.
Hi, good evening. Hello.
Hello, and good evening to all our viewers. Another episode, I think this is 203, something like that. Yeah, all right. Let's start, Jhen.
It's one of our new viewer from Facebook, Miss Rosie Kogo. Her question is, hi, what is PPARS? Can you discuss more about the product? What are the ingredients and where is it manufactured?
Okay, Doc, I'll take this one now. Okay, PPAR stands for peroxisome proliferator activator receptors, all right? Okay, but what our product is actually a natural microalgae, right? We grew it in the agricultural belt in Taiwan. So it's manufactured there in Taiwan. And to put it simply, it's a cell activator, okay, or a gene activator. We have a unique nutrient inside called PPAR agonist. PPAR agonist actually activates your genes. So it activates the pathways that modulate, or let's use a better term, easier to understand, that controls your metabolic functions, your immune response functions. It also controls your immune immune metabolic, all right, cell delineation as well, and inflammation. Okay, so when you take our PPAR tablets, these are the actual microalgae itself. So it's the best whole food, plant-based whole food you can take. So it's the best foundational supplements. Now, our extracts are actually designed for more critical illnesses, such as cancer. And specifically, we help with cancer treatment. If you're taking chemotherapy or anything along those lines, it helps to reduce all the side effects of chemotherapy. Okay, the most important thing it does is protect your bone marrow from chemotherapy damage. All right. At the same time, so that's on the more serious side. Just the tablets and the soft gel capsules alone, that's really good for all the metabolic syndromes. So if you have diabetes, high blood cholesterol, hypertension, all these will be solved all together simultaneously. You don't have to take many different products, just one, because it will help your body regulate your blood sugar metabolism. It will help you with your good cholesterol and reduce the bad cholesterol. And if you deal with both of that, it definitely helps with hypertension and inflammation as well. It also does another thing, which is it actually preserves mitochondrial function. So that's a very technical term, but what it does for everyday people is that it anti-aging lang, or I think a better word today is about longevity. Okay, so it makes sure that your body is energetic and is functioning well even as you age, right? So that's one of the functions. So our PPAR tablets are for everybody. I don't have any cancer or anything like that. I've been eating the product since I was 27 years old. Today, this year, I'm 51. All right, so I've been eating the product for 20 over years, and I'm eating it for the longevity aspect. And of course, as you grow older, you want to control your inflammation. So that in general is what PPARS is. Yeah, we'll move on to more questions as Dr. Jansen answers the questions, as I answer questions. I think you get a better picture. But if you're looking for a basic health supplement that is natural and plant-based whole food, then you don't have to look any further. PPAR tablets is really one of the best. If you're looking for solutions for immunotherapy, immune response diseases, like even things like lupus, eczema, psoriasis, this is also a good solution. If you're fighting cancer, then you've come to really the right place also. So with that, I'll hand the time back to Jhen.
Actually, sir, she has a follow-up question. Can you share the clinical studies, if I may have the hard copy? And are there any long-term studies on the effects of taking PPARS?
Oh, wow. Doc, sorry, today it's gonna be like a lecture. Okay, okay, let me hold on. Let me get ready. We normally don't show this, but let me pull up. Yes, we have clinical studies, all right. It's been published in medical journals. Wiley and Hindawi, these are the most recognized journals that you will be able to find. Hold on, I'm looking for our presentations. I'm gonna just open one to just show you. This I almost never show on our program, right? Because we also present to hospitals and doctors and at medical conferences. So I'm gonna just show you one that we do. This is what I used to present for doctors when I'm talking about chemotherapy effects, all right? So I just want to share with you. Here we go. Okay, so if you want medical data, yeah, we are published in all these, as you can see over here. We are published in all these medical journals, so we have all the things. They are very, very technical. Honestly, even not only doctors like Dr. Jansen, who still loves to study, okay, will actually totally understand these. These are the people who read these journals are actually more medical researchers rather than doctors. Of course, doctors can understand them, but they can get very, very technical. Yeah. So we also you asked about safety, long-term studies. We've actually done this median lethal dose, LD50 test. Actually, very few, I can't think of many or any, in fact, products that are health foods that actually do this test. We do this test because we really want to support patients with medical issues. So knowing that there's no built up long-term toxicity. So that means, for example, if you're on maintenance drugs, you always worry about the effects on your kidney and your liver if you take your drugs for 10, 20 years, right? So we've done this lethal dosage to prove or to assure our clients and patients that even if you take lots and lots of our product over long term, there is no toxicity built up at all. Okay, it's very natural and it gets naturally displaced by your body. Your body can filter out. So yeah, I think even Dr. Jansen has seen this, right? So at the maximum test that we tested is like taking 250 vials a day, all right? And what they found out was just a bit of hyperactivity in the first few days, okay? So you can actually, your body can actually displace that. So in terms of the research, just to show you, it can get very technical. These are the mechanism of action of how PPAR works, all right? So I just show you all this to give you a feel. Yeah, this program not meant to be a medical lecture, but I just want to give you the feel so they can feel confident that yes, when we share here, we're actually talking with evidence backing us up. Right? I do presentation to doctors, and Dr. Jansen is one of the foremost doctors that I know of that is so well versed in his area of expertise. Okay, so I hope that can answer so that I don't go too technical and lose the rest of the audience. But I think for everybody, we are even listed in MIMS. So MIMS is actually the medical catalog for the catalog doctors refer to for drugs. Okay, so I think all that will achieve what you want, which is behind your question, which is confidence that the product is actually science-based, that we understand how it works, why it helps your body. And you can see from the questions and answers later in the program, especially for the very insightful answers from Dr. Jansen, yeah, there is a lot of science behind this. All right, Jhen.
Thank you so much, Sir Shyan. Before we move on to our next question, let me just greet more of our new viewers, Miss Bingbing from Facebook and Miss Melinda Hispano from YouTube. Yan, from Mantilupa. Okay, our next question is drawn to us privately by Miss Nilda. Her question is PPARS also good for trigeminal neuralgia?
Wow.
Okay, very interesting.
Very interesting.
Trigeminal, yeah. Trigeminal neuralgia is basically pain, no, along the distribution of the trigeminal nerve. Now, why is the trigeminal nerve causing such pain? It's usually inflammation. That's one. Another one is nerve impingement, no, or if there is something, or if there's a tumor, no, probably impinging on a trigeminal nerve, that will produce a trigeminal neuralgia, no. But usually the reason is inflammation. Actually, the treatment, the conventional treatment, no. So what doctors usually give for patients who have trigeminal neuralgia are steroids. So, and it really works like magic. The pain disappears immediately. So with that, and steroids, oh, by the way, its effect is anti-inflammatory. Okay, that's the main effect of steroids. Now, if it works like magic, then the root cause of trigeminal neuralgia is inflammation. Now, simplynature PPARS, you can use that together with the steroids so that the dose of the steroids that you might take would be less. Okay, because the steroids, all of us know, no, actually, not all, but patients who are on steroids would know the side effects, no, the negative side effects of steroids, especially long-term use. I believe Jhen would be able to relate with this. Anyway, so with that, no, definitely, since PPARs have very good antioxidant properties, so it would be good. It would be a good anti-inflammatory agent as well. That would help with the trigeminal neuralgia. So yeah, you can take the steroids together with the PPARs, so that the amount or the dose of the steroids won't be that high. So at least you might be able to reduce the dose by 10-20%, which is quite significant. So the side effects would also be manageable, especially if you're taking it for long term already, because trigeminal neuralgia, it recurs.
Wow.
Okay? It recurs very frequently, right? Yeah.
And one of the positive effects that our PPAR protocols, our products have is it's very helpful for your kidneys and liver. So to put it in simple layman terms, it's a wonderful kidney aid and liver aid. So if you're taking steroids, definitely there is I would say uh additional burden, especially on your liver and kidneys, right? So by taking something that actually uh enhances your body's liver and kidney, that would actually also give aid you. And if you and as I know, most people in Philippines, once you're on one medication, it often leads to another and another and another. So another great thing is that, like I mentioned before, it's very likely, especially if you're a senior citizen here in Philippines, after the wonderfully very sweet iced tea in Philippines, you probably have mild case of metabolic syndrome. So we're talking about diabetes, cholesterol, and all that. So it's really one product that actually works on the body at a very cellular level, and it ends up having many wonderful positive benefits. So you can be taking it for your pain, but actually you also benefit by reducing chronic inflammation. So as Doc mentioned, the cause of the pain is inflammation, but there's usually also chronic inflammation apart from that part of your body, other parts as well. So that's going to help with everything. Jhen?
More questions thrown to us privately from Miss Alex. For a lump breast, when is it necessary to go for biopsy? I heard biopsy can trigger the spread of cancer.
Doc, this is a very common question.
Yeah. Okay. So it depends, no, on the characteristic of the lump. So if you haven't, so if a patient comes to me fresh, presenting with breast lumps, breast mass, no, I have to do a physical exam. I have to do history taking. So information that I want to know would be, is the size of the tumor growing? Is it growing in size? Number two, did it present with pain? If it does, when does the pain usually come out? Okay. Is there any pain at all? So that's another. Then characteristics of the physical characteristics of the lump. No, is it hard? Is it movable? When I touch, when I palpate or touch, is it painful for the patient? What's the physical appearance of the breast? No, do we have any nipple discharge, skin changes? So these things will point to a malignant diagnosis or not, no, or malignant suspicion or not. Then we request for imaging studies. So imaging studies like ultrasound, mammogram, is so that I would be able to know, so that I would be able to get more information as to the characteristics of the tumor inside the breast. Okay, if there are calcifications, um, on echo, is it solid? Is it a solid tumor? Is it a cyst? No, so these would point towards the decision whether to do a biopsy or not. But ultimately, the reason why we do biopsy is to know, number one, to confirm our suspicion of cancer. Number two, if it is cancer, this is also to determine treatment. What treatment would the patient respond to? So those are the two most important information that we want from the biopsy. Now, yes, it's true that biopsy can cause seeding of cancer. It can actually even increase the risk of metastasis later on. So unfortunately, that's how biopsy is, no? Especially for breast cancer biopsy. So there are different types of biopsies, okay? So this is specific to a specific to the core needle biopsy that is being done to breast lumps. So for fine needle aspiration, you won't see that increase in metastasis. Now, with this, no, with this concern, of course, it's a valid concern that, hey, okay, we did the biopsy later on, it might spread. So this is also one reason why, as much as we can, if we do a biopsy, surgery has to be done within 2 months of the biopsy. Or else, the risk of metastasis increases beyond 2 months. So this is a must, no? Yeah, this is a must. And the problem, some problem that can arise, no, is if the tumor is not resectable or surgery cannot be performed on the tumor, then that's gonna be a problem. Then you perform the biopsy. However, I think the benefit of that would be we know what medication would be good for the patient, especially for to kill the cancer cells. So that's the pros and cons of biopsy. So it really depends. So it really depends whether to perform the biopsy or not has to be a decision made in agreement with both the physician and the patient.
So, Doc, I think what most patients wish they had was a doctor like you where they can talk to, feel comfortable talking. Right? Doc, I just want to ask, it's obviously very clear that even though there are dangers of the biopsy, if you are planning to use conventional medicine, that means surgery, chemotherapy, immunotherapy, the risk of biopsy the benefits of biopsy far outweighs the risk, right? Because
Yes.
yeah, okay. Because then you'll know exactly which of the many drugs and types of chemotherapy you will use. If you don't do your biopsy, you won't know what to use. Just for
Yeah.
this particular viewer, many people think that, oh, I have breast cancer means one type of cancer. No, even with a breast cancer, like we had a mutual friend or my friend, which I referred to Dr. Jansen, in her breast cancer tumor, there were 5 different types of cancer. So in one tumor alone, there were 5 different types of cancer. So although normally when we speak to one another, when you hear on the news or watch a program, they just say cancer. But it's actually many, many different varieties. And every cancer has a specific type of drug. You don't use drug A for cancer type B. In fact, it can be bad for you to use the wrong type of drug on the wrong type of cancer, which is why the doctors have to know exactly what type of cancer you have, which is why the benefit of a biopsy far outweighs the risk. But Doc, I want to ask a question in this particular scenario. If let's say a patient is pretty old, okay, like 70 years old, he really decided he's not going to do like, doesn't want to go hospital, okay? He just wants to be as strong as possible. If he goes, he wants to go natural. If he dies, he wants to die with energy. He doesn't want to be in the hospital bed. He just wants to be as strong as possible. But yeah, he will be disciplined and try to take like supplements, change his lifestyle, and then he if he can get well naturally, he will. If he doesn't, he's okay because he's lived his life long enough. He's at peace. Okay, for such a case, is biopsy necessary then? Or
Okay, very good question. I will not perform the conventional biopsy, but
okay,
I might recommend a liquid biopsy.
all right. So
Yeah.
at least we get
So
some picture, right?
yeah. So the value of the liquid biopsy is we can get information on the cancer, aggressiveness of the cancer, what medications and natural extracts that would be able to kill the cancer. So that's the beauty of liquid biopsy. And the sample is just your blood.
Doc, how much is liquid
Yeah.
biopsy? Just so that everybody.
Okay. Okay. Um, the one that I am affiliated with, no,
RGCC,
is
right?
RGCC.
I
Yes,
actually know
RGCC.
I don't know whether he's still the CEO of RGCC. Yeah, but yeah.
Yeah. So RGCC is a laboratory. It's a genetic testing laboratory that analyzes. They basically analyze genes. No. So what happens is the blood that we get from the patient, we send it to them. Then they count the cancer cells one by one.
Wow.
Then they separate the cancer cells. Then they grow it in the laboratory. Once they grow it, then they subject the cancer cells into different drugs and all. No? So chemotherapy, targeted therapy, immunotherapy, a lot of natural extracts. So this procedure is done in Greece. So since we're here in the Philippines, and basically for Southeast Asia, no, all patients in Southeast Asia, they send the samples to Singapore. Then the Singapore team sends it to Greece. Okay, so with this
Setup.
mechanism, with this logistics, no, and all, no, and the testing the very comprehensive testing that they do, the cost would be, well, would be high, it would be high. So the price so I'm going to send you the price in in SGD.
Right.
Okay. So in SGD, it's 5,170.
Wow. Okay, that's quite a lot. Okay.
Yeah, 5,170 Sing dollars.
Wow.
Since we're here in the Philippines, we have to do some currency
That
conversion,
will be
and all.
about
No? So,
200.
yeah, approximately 230,000 pesos.
Yeah.
But here's the thing.
Hmm.
For cancer, your 230,000 is actually, if you think about it, 230,000, you can spend that in under 2 months, probably even less.
For cancer
Now,
treatment.
if yeah, for cancer treatment. So here's the difference. Here's the difference. Usually, what we do is empiric treatment. So when we talk about empiric treatment, it's like shotgun treatment. So we have a protocol that will address um all foreseeable aspects of the cancer.
So it's not so targeted. It's
It's not
more,
so yeah, it's not.
it's not so,
It's not really.
not
Yeah,
tailored.
it's
It's
not
not
really.
personalized. It's not
Yes,
personalized.
it's not personalized. Now, empiric treatment. So, but when I say empiric treatment, that's the conventional cancer care,
Mm.
and that also include the alternative side of things. So,
Okay.
non-conventional. So, even my practice, actually, even my
Yeah, like for
practice.
example, if you do vitamin C infusion,
Yes,
it's a
yeah,
general. It's not like
it's a
tailored
general.
for
Yes,
your specific cancer. It works for
yes, yes,
multiple
yes.
cancers, right? Yeah.
Yes, yes, multiple cancers, but we don't really know if it will work for you or not. We just know most likely it will work. So it's just based on statistics.
Yeah.
That's how cancer care is. So that's why um the cancer treatment currently is based on statistics. What if you're an outlier?
Yeah.
Which you know
Always
is
possible.
quite possible. Actually,
Always
I
possible.
won't say that it's uncommon. It's actually quite common.
Oh, really? Okay, that's
Yeah.
interesting.
Yeah, being outliers, so it's quite ironic actually if you think about it. So you have that empiric side of things wherein you just, okay, you have breast cancer, okay, most likely you will respond with trastuzumab. So let's give you trastuzumab.
If it
Yeah,
doesn't
there.
work, then we try
If it
something.
doesn't, yeah, if it doesn't work, then shit, you just spend 200,000, 300,000, 600,000 for nothing. And you spend all that time for the treatment that was not effective.
Mm.
Now, with this RGPC test, you would be able to buy time. The treatment would be targeted because you already know immediately on the get-go that
Yeah.
the things that you take would be effective for the cancer.
Yeah.
Because they have tested it in the laboratory.
Wow. Okay.
Okay, so that's the value. So long term, cost of treatment wise, no, long term, empiric treatment would be more expensive because there's trial and error.
Mm.
For personalized cancer treatment, it would be more cost efficient. In the short term, it would be more expensive, yes, but it's targeted. So long term wise, um, there you won't take 10, 15 different kinds of supplements. Instead, you
Yep.
probably might just take what, five,
Yep.
six, which is way better than the empiric treatment that usually that we undergo. No? So that's the pros and cons. So, there's a price tag.
Yeah, so actually, we always say on our program, on this program, Doc, we try to be as encouraging but also as truthful as possible. So one of the limitations when we're trying to help patients or viewers, right, is really this. There are many, many options for improving how you can treat cancer, but one thing many people feel are restricted by is how much money they can spend. If the more money you have, the more options you really do have. But again, we want to say, don't think that because you're not a multimillionaire, you're not going to get well from cancer. All right, that's not true. With good foundational knowledge, with discipline, I think that is very important, right? If you don't have money, then you better have discipline. All right. If you don't have money, you must be disciplined to eat the right stuff, do the right thing, and you will also do well and get well from cancer. Doc, I think this is a follow-up question from Christine because she said, is it much better to remove the lump first, then biopsy? which I think the answer would be yes, right? If you're going to remove the lump, don't need to do a biopsy. Just remove the lump, then they will do the biopsy on the lump after they remove the lump from your body. Okay, so
Yes.
you don't have to risk it twice. Yeah.
Yes. Now, I'm not a surgeon, okay? I'm not a surgeon, but if I prefer for the surgery to be done first. So do an excision.
Yeah.
Then once the tumor has been excised, then just analyze it under the laboratory. That would be a better
Yes,
path.
it's the safest.
Yeah.
It's the
However,
safest
I just
because you
don't.
remove the chance of the thing being spreading.
Yes, yes, yes. But I just don't know if there are situations wherein you cannot proceed with that kind of path. A biopsy really has to be performed first, a core needle biopsy, before you excise or before you go for the excision surgery. Um, yeah, one such situation that I can think of would be if the tumor is really very large and on CT scan they cannot really perform a surgery without shrinking the tumor first. So that's one situation. But for sufficiently small tumors, I
Just
just
remove
don't
it.
know if I'm not a surgeon. So probably you have to attend
Okay, so
the
I
June
have an
event.
answer. I have answer for this particular viewer, right? On June 6th, sorry, on June 7th,
Seven.
all right, on a Saturday, Dr. Jimmy Katapia, one of the top surgeons in Metro Manila, Dr. Jansen, that you see now on screen, and myself, and even Jhen, we will be live in person at SMX Aura. Okay, we will all be together on the stage. So when you ask one question, at least four people will answer you at the same time. So you know, Jen will later share how you can get the tickets, right? Come on June 7th, which is very soon, slightly more than a month from now. Okay, and then you will be able to hear straight from Dr. Jimmy. And it's not like you need to type, you can literally have a conversation with him. All right. And Dr. Johnson will be there when Dr. Jimmy say, okay, I've answered this part. I think the next part, Dr. Johnson is the best expert. Just like what Dr. Johnson did tonight, right? It's wonderful when you can get a group of doctors from different specialties to speak together. Doc, she also wants to know what's the difference between a lump, a mass, and a cyst. This is
Okay.
like
The term lump and mass are interchangeable.
it's the same thing actually.
It's the same thing. It's basically the same thing, a mass and a lump. No? A cyst is okay. You have different kinds of lump slash mass. So
Okay.
you have solid tumors, lump, mass, and tumor are also interchangeable.
All the
Okay,
same. Same
so
meaning.
yeah, same meanings. It's basically the same, no? So you have two different kinds of mass. So you have a cyst. A cyst is a lump that has fluid inside.
Okay.
So yeah. So when you feel that, it's gonna be solid as well. Okay.
Mm.
But it's water inside. Probably a little bit soft, no?
Mm.
The
So
other
the
one is a solid. Yeah, yeah. The other one is a solid tumor. So that's the solid tumor is really basically solid. So that's
so
the two different kinds.
okay, so the difference the difference between a cyst and a lump. A cyst is a type of lump. What
Yeah.
makes it a cyst is that it has liquid inside. The other type of lump doesn't have liquid, is solid
Yeah,
fluent.
it's solid. Yeah, yeah.
Okay, so that wow, okay. I think some of our viewers must be asking, if it's a lump, then call it a lump lung. Why must it call it a mass or a tumor? It's so confusing. Okay. But yes, all three things are the same. Okay. For for very scientific people, they'll probably use the word mass. All right. For medical within in a medical setting, maybe tumor would be something easy to understand, to let a patient understand. When you're talking to your neighbor, you probably say, I have a lump. Okay, but it's the same thing. Yeah. Okay, Jen?
Okay. More questions on Facebook from Ma'am Belle Dican Endozo. I would like to have a personal consultation with Doc Jansen.
Oh,
May I
okay.
know where I can go for that? Okay. So the
Uh,
link to schedule an appointment is in the description box and comment section below. And now that you've already commented, our healthcare specialist, Miss Beth or Miss Irish, will reach out to you shortly, ma'am.
All right.
Okay.
Jen, I just want to answer Miss Rosie Ko since she asked,
Ah.
has anyone had side effects of taking PPARS? Okay, this question is a bit of a loaded question because when you say side effects, I assume you mean a disaster or not good effect. Okay, why must I use the word disaster? Because for example, okay, you have an old injury. It's sort of okay, but it's just sore. It's just sore. You take PPARS, and then suddenly that night is very painful in that old wound. To many people, as long as it's pain, that's a bad side effect. All right. But the truth is, what's happening is that the old wound is being triggered. The body's actually trying to heal or treat an old wound. Okay. So in that process, you're gonna feel pain. Okay. So another example of side effects that people I need to be careful here is because uh for example, in Chinese medicine, if you pop your joint out of your joint got popped out, if they're gonna pop it back in, it might be very painful. So the side effect of popping your joint back into its socket is that you're gonna have a lot of pain. Okay. So another thing is for when in Chinese theater, where they massage when you sprain your ankle, right? In Western conventional medicine, you put cold press, right? You stop the blood from rushing there so that the swelling will subside. The Chinese approach is actually to go and massage the thing. All right. So the theology, the methodology is very different. For them, they want to make the blood circulate so that the clot, all right, from the sprain starts to dissolve. So it gets even more swollen, but actually the healing is faster. So in fact, like for example, when I was growing up, if you had a fever, they put blankets on you. In the West, if you have fever, they throw you in an ice bath, right? And at first, people don't understand why. What is the logic that you put a blanket? But I'll give you a very simple understanding. Have you ever, when you were a child, you were not feeling well, right? A little bit of fever, but you still want to go out and play with your friends. You go out and you run in the playground, run, 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 run. And then when you come back, you feel better after you sweat it out. All right. So actually, the approach is that if I get it, if I'm right, the virus, when you have a flu is virus based, the virus has a lifespan. And when temperature goes up, the virus actually goes through its lifespan faster. So literally, you are sweating the disease out, letting it go through its cycle more rapidly, and that's where the fever breaks. Right. This is what the thing. Okay, so now let me go back. Okay, so will there be any side effects that when you're taking PPARs? Yeah, you might have something we call in integrative healing Herxheimer reaction. That means when your body gets healed, there is going to be like mucus coming out. You actually cough more because the thing needs to come out. We actually have patients where, for example, they have lung issues. They take the product, start coughing, and then like lots of phlegm comes out and then it clears their lungs, right? But if you're coughing, you're thinking, oh no, when I'm sick and I eat drugs, I don't feel anything. I feel better. I don't cough. My cough disappears, right? So in that kind of in that sense, yes, when you take PPARS, there is going to be a Herxheimer reaction, especially if your illness is not super serious. If your illness is super serious, usually you don't have Herxheimer's reaction because your body doesn't have excess energy to do any Herxheimer reaction. And whatever your body is healing, like even if you cough, you will immediately feel better. You will not think that it's a bad thing, all right? For those who are seriously ill. But for those who are moderately ill, sometimes it's hard to interpret because you thought you were feeling okay, manageable, then suddenly your cough gets seemingly worse, but actually your body's actually recovering. So on that part, I would say, yes, it's possible to have these Herxheimer reactions. Number two, is that negative? I mean, really negative that, oh, it's not good. It's like allergic reaction, you cannot take it. No, I've never had anyone with really negative side effects from taking PPARS. Okay, and I've been taking it myself 20 over years, and we have had tens or maybe even hundreds of thousands of clients and patients over the last few decades. Okay, so no, in general, no. Okay, do you have to take PPARS for life if for diabetic case? It depends, right? If you're type 1 diabetes, most likely, right? Because you actually have a genetic flaw. Okay, if you have type 2 diabetes, the answer is no. You will have to take it for some time, minimum 6 months, maybe even a. After that, basically, your body, how it works is that it reverses the root cause. So for type 2 diabetes, you're insulin resistant. But when you take the PPARS, you actually become insulin sensitive again. So your body is actually restored back to its original state. Okay. Can you then redevelop or develop your diabetes again by poor lifestyle? Yeah. If after that you say, "Oh, I'm good," and then after that you eat 3 bowls of rice every meal and take lots of fatty foods, eats lots of cakes. You know what? After living like that for about another 6 months to 1 year, your diabetes is going to come back. All right. But even a healthy person who lives like that will get diabetes. So no, the answer is you don't have to be on it for life. All right. Unless you have a genetic flaw, right? Which means that it's just a lacking. Your original state is not perfect in the first place. So even if we bring you back to your original state, you will still need the help of the PPAR. So yeah, I think that answers your question. Our website is simplynature.asia. Okay. Maybe you just give a yell out, someone will answer you and be able to answer more of your questions on a personal level. Okay. Yeah.
Okay, moving on to a follow-up question of Ms. Bell Dikdikan Endoso. I'd like to ask if I'm still eligible for PPARS. I was diagnosed with breast cancer in 2020, but I only underwent immunotherapy, radiation for 30 days, and take a lot of organic supplement. I didn't have chemotherapy, so no chemotherapy.
And you are well now. What's her current state? What prompted her to want to ask this question?
So her question is, would it still be possible for me to take it now?
Oh yeah, the answer is definitely yes. My question is there a specific reason? I'm sure Doc Jansen is also curious. Are you taking it for preventive to maintain your good health, or happened recently and you're kind of worried that maybe the cancer is coming back and then you want to do something? So let us know what is your status, so that we can properly advise you. But definitely, if you want to take something that's anti-cancer to help you reduce the chance of your cancer ever coming back again, then PPAR tablets is one of the best starting point. Okay? And then if something happens, like for example, you have pneumonia and then you are very weak and your immune system is low and you are worried that experiencing a pneumonia and then long period of recovery, you're afraid that there might be some cancer cells in your body will take the opportunity to make a comeback. Then during those times, I can suggest that you take our soft gel capsules or even extract powder during your recovery. So you're a cancer survivor, for example, and then you went through another bout of some other illness, okay, that you spent some time in the hospital, and then you come on medication and you're feeling weak and you're worried, oh, in my this weakened state, will my cancer reoccur? Yeah, during that time, then I would suggest you take either the soft gel capsule or PPAR powder to even more strongly strengthen your health in general, so that you are in a better position and that your fears won't come to pass. Yeah. Doc, anything that pops into your mind?
For this patient, I really need to speak to you.
Yeah.
So I can answer you more accurately. But just for everybody's knowledge, education, for everybody's learning. If a patient presents to me, underwent treatment completed, though. Completed treatment, everything have been done. Then the patient is.
What do you help a patient to? What do you put the patient on, or what's a general strategy for a patient who successfully beat cancer? How do you share with them what to do to make sure the cancer doesn't come back or
So here's a preview on what I do. So there's basically two recommendations. One is two recommendations for which I would have the patient choose. So the first one is again the empiric approach, like the one that I described a while ago. However, at this time, I would just make sure that the patient has adequate nutrition, make sure the lifestyle is good, supplements that's needed to make sure the immune system I would give. Another one would be to kill the cancer stem cells. Because the stem cell like cancer cells are the ones that metastasize and produce tumors. So those are very difficult to kill. Okay? It cannot be killed by chemotherapy because these stem cell like cancer cells are dormant. For chemotherapy to be able to kill a cancer cell, the cancer cell has to be actively dividing. So for stem cell like cancer cells, they don't.
Dividing. Yeah.
They're slowly dividing. So if it's slowly dividing, then chemo won't be able to kill them. So we have to kill those cancer cells one way or another. So one such method that I use is intravenous high dose vitamin C combined with doxycycline. So that can. Other medications that I repurpose for that are mebendazole and ivermectin. Now, here's the difference. For a patient who has active cancer, I would put the patient on this for at least 6 months. For at least 6 months, no, until I see cancer progression. So until I see cancer worsening or cancer increasing in size and number, then I will change my strategy. For a patient who is in remission, 6 months is the cutoff. 6 months. After 6 months, then we're done. Okay. However, that the question still remains, no? Was the treatment effective? Because we don't have any baseline measurement.
Yeah, because nothing happened,
objective,
right? Because nothing happened.
because
Which is what you want. You don't want the cancer to come back, right? Yeah.
Yeah. So we have to have some degree of measure of your cancer. So that measure will point us to option number 2, recommendation number 2. So recommendation number 2 would be personalized. So what would the path be? What would the path look like? So first, we have to do a liquid biopsy again. So patient in remission, completed treatment, a history of cancer, no evidence of tumor on recent scans, nothing. Okay. What kind of recurrence prevention would she have to go for? Okay. So we do a liquid biopsy. What do we look for? We look for circulating tumor cells. Okay. Because if there are circulating tumor cells swimming in the blood, then chances are you have to do something, and metastasis is just around the corner.
Yeah, this is
probably
the type of case where a person is celebrating with the family because they fought cancer for 9 months, and finally after spending a lot of money, everything is okay. Then 4 months later, they start to feel unwell. They go to see the doctor. The doctor say, "I'm so sorry." And then they are so disappointed. They don't understand. They will say, "Hey, I thought you said I'm okay. How come it's just less than a year my cancer came back?" So is this doc? And correct me if I'm wrong. Huh? The one that you're talking about, checking for circulating cancer cells, this is not the 200,000 peso test. This is a one that is actually
not
much
yet.
more
cheaper
much
test.
cheaper, right? I think it's like what, 50 to 70,000, right? Even
wait, let me check the price in Sing dollar.
Okay.
I have the price list open.
Yeah. Because I'm sure, if you are a cancer survivor, you already spent a lot of money with all the treatment, and then you say, another 200,000? No. This one is not. This one is not. All right. This one is just.
No, it's not.
It's like cheaper than a CT scan, if I'm not wrong.
Yeah. So in Sing dollar, it's 1,670.
Okay, so it's about 50,000-60,000 pesos.
But 60, 70 probably, around 70 something.
Yeah, which is your CT scans can also be very expensive and things like that. So it is a bit more expensive than a CT scan, but it's still okay and affordable.
All right,
Yeah,
and
affordable, yes.
I think the peace of mind is really there, right? Okay,
Yeah,
how
the
how
peace of mind
early
is, yeah.
how early before you do this circulating cancer cell count? Is it immediately after you've been declared, or do you want to give like the cancer a bit of time to build up the numbers so that it's more easily
Oh,
detectable?
oh,
Uh,
okay. You can, okay, the earliest, so say for example, you underwent radiation therapy,
then you are
chemotherapy, the
clear.
earliest that you can get this is 1 month after the last session. 1 month.
So 1 month after the doctor clears you of everything and say, I don't need to see you,
Yeah.
yeah,
You
basically
can, you can.
you wait for a month. Okay, is there any advantage to wait a bit longer? uh
Well,
would it mean that you,
yes.
because some people only have a budget of like 60,000 per year. So if they do it
Uh-huh,
too
uh-huh.
early, then they thought they're okay, but it because when you do it too early, maybe it's harder to detect, right? Any cancers. Yeah, so
That's true, that's true.
so will you say maybe 3 months later they do, and then and those who survive a year already, that is actually a good time to do it, right? It's because it's been a year. So if you
Yeah.
want to do it and then you say, oh, and it's still clear, then I think you can really sleep very well at night. Because even after
Okay.
1 year, there's no trace of cancer cells circulating in your body. I think you can really say goodbye, sayonara, bye-bye cancer, and then you don't have this fear in the back of your mind.
Mhm.
Yeah. So
So there's no specific guideline
yeah,
in which
just using
they told
your
us, no, this
personal
is how you
opinion
do it.
now, right?
Yeah, this is my this is how I see the test working, and yeah, this is how I see the test working. So what they told us, no, earliest that you can do the test, no, is the circulating tumors that you can do. Radiation. Can you
Yeah,
would waiting,
yeah.
would it matter?
Or would it
Even, yeah,
matter?
would it
Will it
matter
make a
at all?
difference?
Here's the thing: the negative tests for us to declare you cancer doesn't matter
Okay,
where you start the first one.
because you
Because you
need
need
three.
it's the how long is the interval between three? Then if you get all three negative tests, then that's, yeah.
Be enough money to do it once, lah. If it's still negative, I did it six
Yeah.
months ago, it was negative, and now that I'm doing it on the 8th or 9th month, negative, I'm effectively
Yeah.
you trying to hack the system. Wait, but okay, now this is that there are many cases it declared cancer free, suddenly the cancer comes aggressive. Okay,
Yeah.
so here it is. If money is tight, then the best bang for your buck, and give you the most peace of mind, maybe around 6 months. This is just opinion, and this is really opinion, because there's no hard and fast rule about this. We're just discussing with you as individuals, all right? Because doc already gave you the technical answer. The technical answer is 3 months, 6. Okay, in specific circumstances, how. So I think that is what I would say to you and recommend lah. Okay. Yeah. When you ask this question, let me first you are crossing or crossed your 5-year mark, and yeah, the best thing for you to take now is just the tablets. It's tablets. Now, if you have other health issues, for your any other thing, not
then I would suggest why don't to get strengthen your system, and you will start to enjoy. So effects of the tablet is energy level. So most cancer survivors fatigue. Some people take a long time to recover to their pre-cancer level of their body. So yeah, having a basic all natural plant-based whole food supplement like anti-aging and I that's our. But if you have some suspicion that is worrying you, I suggest have a consult with Dr. Jansen. Okay, and then you put your fears to rest. Okay, Jen.
Okay, we're almost at the end of tonight's session. This will be our last 3 questions for the evening. So first is from Dearest Che Santos. Dr. Jansen, do you give chemotherapy treatment?
Oh, okay.
Yeah.
Jess, no? Chemotherapy is being given by surgical and medical onco. Okay? So, support as well, wherein they cannot undergo chemo already or radiation or the recommendations suggested by the onco. That's also where I come in. Okay.
Here, and sometimes he speak very for people to understand where is his okay, so let me put it in a way that's easy to understand. Okay, why we love to work with Dr. Jansen and why patients love Dr. Jansen, and why oncologist he prescribed us surgery for good friends together even with and work together. Okay, so okay, because Dr. Jansen's dream when he was in med school is to be an oncologist, but he has a very interesting personal story of how he got into is more doctors, lifestyle medicine doctors want or support today, but you right, whether you're doing it totally natural with chemotherapy, is why I like Dr. Jansen drugs. Oncologist because he will relax oncologists are the administering the chemotherapy. Why do I say this is important? There are so many people who give health advice. Oh, take this, take that. But they don't know the drugs that you're taking. They don't they be so sure and give them won't affect your hospital, right? So we trust Dr. Jansen because he knows the type of drugs, he knows how it works. Okay, this is happening. That's why now he actually knows what to you actually is correct. Imagine know anything about chemotherapy does become to prepare your body for the drugs to be most effective and the side effects natural, right? One who is a doctor and also keeps the option open. You know, one thing, Ms Sheila, who is for I say that yeah, didn't want him to do chemotherapy because saying, "Oh my God, chemo," right? So she didn't want. Maddie, right? Actually told her emergent Jansen. She used to be a doctor. So this is what she said. One must do chemotherapy. His cancer is aggressive. He does chemotherapy. But if he does chemotherapy, she said chemotherapy, but go and look for how to strengthen your son so that the chemotherapy needs won't kill him. And the good news is you can see Sheila smiling. Maybe next week she'll be our host. I'll ask her to share. Dominic is totally recovered. And Dr. Johnson, I just had during Holy Week, I just had tea with Sheila and her husband Don brought me out to eat, and Dominic came. And Dominic is like an adult. He's very smart. He's really smart kid, you know. So we were so happy that his life is safe. So here's a perfect example, right? Imagine you just met some person who believe in natural, and then he'll tell you, and if Sheila had met a doctor who was not like Dr. Maddie, like Dr. Johnson, who didn't know the seriousness of it from a medical point of view, will just say, no, natural, let's go on natural, let's go on natural. I think it's perfectly fine to go natural, but you should also know when, even if you want to do natural, there are times where you really need to do convention because it's critical. Speed is important. So I want to share with everybody, you know, one of the advantages of drugs and surgery is that it works very fast. So if your cancer case is serious and time is not on your side, you know, you really have to have someone who knows both sides, what they're doing, and they can give you proper advice. So this is why Dr. Johnson is being humble, or he's talking in a doctor way, harder to understand where is his strength, but this is his strength. He actually knows what he's talking about. So when he shares something natural, he shares it with the knowledge of how the chemotherapy works, how the radiation therapy works, how the immunotherapy works. So he's not just coming from a natural aspect. He is coming from both. And this is why we like him. Amen? Okay. Okay. That's my testimony for Dr. Johnson. And this is why I've been with him doing this program for 4 years, right? Jhen?
Thank you. Thank you for the kind words.
It's kind of a long question from Facebook. Miss Maylene Matining Phil Invest. Hi,
Okay.
I would like to ask, if I take PPARS, can I not undergo chemotherapy? I'm breast cancer stage 3B. I was recently diagnosed with breast cancer last week. Oh, and I'm having a hard time making a decision because I'm scared of chemotherapy. I
Oh.
also have a wound on my breast. I was told that chemotherapy should be done first before surgery. Is that really the usual process? Thank you.
Yeah,
Go,
that's
Doc
that's
Johnson.
true. That's true. Yeah, that's true. So for breast cancers who have ulceration or wounds already, one of the more effective ways to stop the bleeding is chemotherapy. So I have encountered patients who have breast ulcerations who underwent chemotherapy, and the bleeding just stopped. The wound just dried up so fast. Okay. So that's one problem that we actually have to address aside from the cancer itself, the wound, because the wound has a risk of getting infected, and if it is not treated, then number one, your quality of life is gonna suffer. Number two, your risk of dying of sepsis.
Yeah.
Okay. Okay. So the question would be, do we have anything other than chemotherapy that can help stop the bleeding and address the wound? right now, the only answer that I know of, aside from chemotherapy, is radiation therapy, which also works wonders. It stops immediately the bleed. In my experience, I have to be honest here. I haven't had a patient who did not undergo chemo and radiation, um, and the bleeding stopped. No, so the bleeding was just there. The ulceration was just there. Okay. Now, the next question would be, for treating the cancer itself, do I really need to undergo chemotherapy? So to answer that, yeah, to answer that question, then the personalized test, no, the liquid biopsy, we will need that. Okay, because from the information that we will get there, we would know the natural extracts that would be good for the cancer. So probably so, we can utilize natural extracts that have cytotoxic effect. In other words, that can kill cancer cells like chemotherapy and use it on you.
Yep.
Okay. So that test we need.
So
Okay. So
yeah, I want to also I guess chime in, because what I heard very clearly in your question is this. It seems to me you know chemotherapy works. If not, you won't even be torn, right? If you don't believe in chemotherapy, you won't even think. You just say, nope, I'm going on natural. The fact that you can't decide means that you actually, part of you knows it works. But what is stopping you is that you are afraid of the side effects. Okay, so I want to share with you right now. This I'm not going to just share about technical science. Okay, I'm going to share real life experience, and these are my titas, right? Not my blood titas, but my titas here in Philippines. My close, they are actually friends of my father, right? My family friends. Okay, I have a Tita R, I'll call her. She had third stage breast cancer. She went for chemotherapy, and she had almost zero side effects. She had almost zero side effects. She actually comes from a rich family, so she can use every kind of treatment that she that's available to her. And then among the people around her, many of these rich people, they always very crazy about being natural. So many of her friends advise her, no, don't go natural, don't take chemotherapy, go natural. Well, so in the end, she decided to go for chemotherapy, and for her, that was the right choice. Why? Almost zero side effects. She didn't even lose hair, but she shaved her hair. And why do people shave hair when they go for chemotherapy? Is so that you don't affect your emotions. Because when you see hair dropping, you will feel very sad. Okay, so what they do is they shave so you can't tell whether your hair dropped or not. Okay, so not everybody who wear a bandana, actually the hair is dropping. Okay, it's just that they shave as a standard procedure so that even if your hair drops, you can't tell, so you won't be discouraged. All right, so there's many people don't know that. They think that they shave their hair because the hair is dropping. Even before your hair drop, they already shave your head. So you will never know whether your hair drops or not, so that you won't be discouraged. Okay. So, and she was sharing with me when she had cancer, of course, she went around to meet other people with cancer. And some of them who chose to go natural actually died, whereas she totally recovered. So I want to let you know, maybe because of the way we ask questions, most of the time when we hear testimonies about going natural, we always hear success stories. That is actually not true. Many people die when they go all natural. All right. So another one that I want to share with you is one that is Dr. Johnson's patient. And my friend actually had breast cancer. So she decided to go all natural. She did. And guess what? She recovered. She actually recovered, right? However, after she recovered, I think like 6 months later, the cancer came back, and it came back very aggressive. Okay. And after that, I don't think she lasted more than a year. Okay. So pretty sad, because we were very happy for her to have recovered. So later, as we examine her case, we realized, had she gone for chemotherapy early, right, doc? That was our thing. And she might have beaten the cancer more thoroughly so the recurrence wouldn't have happened. And actually, me and Dr. Jansen were looking at data, very interesting. People who healed themselves of cancer naturally had a higher recurrence rate. Remember, Doc, we saw that one? Had a higher number of people who treated and got well naturally. Actually, more of them had their cancer come back. And I think the reason is because you didn't kill the cancer enough, right? Because chemotherapy very toxic, which is why you are right, you're afraid of the side effects. Okay, so why did I bring this up? Here is your solution. With Simply Nature PPAR, especially our Simply Nature PPAR liquid, we can protect your most important organs like your bone marrow from the worst damage from the chemotherapy. Okay, which means that yes, you might feel tired and not feel so comfortable, but you know what? Chances are that all your healthy or all your important organs, your organs will be protected. So you will only probably feel the fatigue and a little bit of discomfort. But all the horror stories you hear about chemotherapy, it won't happen to you because you're taking something. And this is why Dr. Jansen is the perfect doctor for you. Okay, because Dr. Jansen, when you are going to go for chemotherapy, he's going to look at the chemotherapy drugs that you're going to take, right? He's going to help you protect yourself from these negative side effects from the chemotherapy. So then you have the best of both worlds. You have the thing that's most toxic for the cancer, and then you have the best natural protection against this chemotherapy so that your healthy cells don't get affected. This way, you have the highest chance. And I would suggest this because you actually have third stage cancer. Third stage cancer means your cancer has already begun to spread. And I'm sure this is pretty shocking to you as you shared. You only found out last week. And many cancer patients say, if I just found out last week, how come I'm already in the third stage? Should I be in first stage? It's so unfair, right? How come I didn't notice? How come nobody notices it and straight away I reached third stage? Well, that's the issue, that cancer is actually hard to detect until it's really fully developed, right? And by the time it's fully developed, time is not your friend. So that is why, yeah, and good news, you have actually, not say good news, here's the encouraging news. You actually have breast cancer. Breast cancer being one of the more common cancers, all the drugs for breast cancer developed, okay, which means there are side effects over the last 10 drugs work. So the more manageable or more rare types of cancer. Patients with breast cancer using the drugs, they actually improved the last 10-20 years from many years ago that they keep retelling, right? Doc, maybe you can share what's your take about how the treatment of breast cancer has actually improved a lot in terms of immunotherapy, chemotherapy, and so on and so forth. And depends whether your oncologist is up to date or not, right? So Doc Jansen is up to date, so you can always ask him, Doc, is this the best chemotherapy drug that my onco is giving me, or should I have a second opinion and maybe find a better onco, okay, who is using the newer drugs, okay? That you can actually spend time with Doc Jansen. Doc, yeah.
Yeah. So in terms of advancement, cancer treatment has really advanced quite a lot, no? Especially nowadays. Uh, Chemotherapy is not the first thing that any oncologist should be recommending. Um, we have to first determine, no, if if the newer medications would work for you, because the
Yeah.
newer medications have less side effects. I have a few cancer patients stage 4 who are on these newer medications.
Wow.
They're still alive until now. I've been handling them for almost 2 years now.
2 years. Four
Yeah,
stage
2 years.
cancer, that's really good.
Yes, and they're improving. I mean, there is a patient that I am handling wherein the nodules have significantly reduced in size, and this is stage 4 cancer. No?
Wow.
Side effects. You cannot actually see any side effects on the patient, so this is quite. She's quite fortunate. I should say. Okay. Now, of course, another advancement that we have now is we can already determine if which among the cancer medications that we have that would be effective against the cancer. We can also know if these medications that's effective for the cancer, if you will experience side effects in any of these. So we can even know this. No? So the after undergoing the tests, no, the tools that we have would really be designed for you or personalized for you. And you can stay on it for long periods of time, especially for natural extracts. Because natural extracts are, they're milder on the body. Okay. So in terms of advancement, I should say that cancer treatment has quite advanced quite a lot already. In the next decade, since we already have AI, we're in the advent of AI, and AI is actually doing leaps and bounds. Yeah, it will accelerate a lot of drug development. No, so we have a cancer treatment called cancer vaccines. So cancer vaccines is where you get a piece of the tumor, or not a piece of the tumor, no, a receptor or gene that is unique to the tumor, and develop a vaccine against that, so that your immune system will be able to recognize that molecule or whatever cellular material that is, no, that is unique to the cancer. So your immune system will kill the cancer. So chemotherapy for me is a thing of the past. For me, it should not actually be even be recommended as a first line treatment.
Wow.
Mhm.
Okay.
Unless there's really no other things that would work against you, so we just give you the nuclear bomb. Yeah. But nowadays, since we already have the liquid biopsy technology, so I don't think it's even needed. And this is also true for sarcomas. Okay? Sarcomas are really rare kinds of cancer wherein treatment options are really very limited. No, so even sarcomas we can determine what treatment would be good. No, so
You know, to all the viewers who are new to our program, actually, what Dr. Jansen is saying right now is quite evolution of his own practice as well. All right. Yeah. So I can tell from what Dr. Jansen is saying tonight, he recently went overseas for another conference again. So I can tell that he came back with new understanding, new approaches to cancer treatment, which is, I guess, why I noticed today our viewers are actually hanging on. Nobody left early. It is actually very interesting. What we heard as long as last year or 2023, the way we treat cancer in 2023 and now in 2025, there is actually vast differences. All right. Now, the one thing that I do know in Philippines is very real is that finances. It's about like, for example, the oncological test is so expensive, right? I can tell you, doc, one of the great challenge for patients is this: they may end up spending the same amount of money as doing the oncological test first and then going for their treatment, but they will end up having no choice but to do the treatment first. The reason is that they cannot come up with like 250,000 peso one shot, but they can come up with 50, 60,000 thingy. They will still end up spending the same amount of money, but they just cannot take it out one time, right? So which means that they can only afford to pay for the treatment. They cannot pay for the really expensive tests in the beginning, right? But again, this is not all bad news, right? Why? Because okay, if finances is very difficult, you need to hold the bullet back, all right? You can get a good doctor, let him make the best judgment, give you the best diagnosis, and prescribe to you what he believes will be the most ideal drug for you. If it works, then great. All right. If it doesn't, you still have the option of the liquid biopsy. that's when, you know, okay, I can still, you know what, I'm going to get my whole family to chip in because the current drug, the first thing that we tried is not working. We can't just keep on trying. This time around, we really have to put in the money and figure out what will really work for me. So yeah, so there actually no one way to fight your cancer because many of us have many different circumstances. Money is always one of the things. So we have to be a bit, I guess, creative. But in the being creative, we must have a clear understanding, clear logic that is correct. So we can make the best out of whatever situation you're in. Of course, the most ideal situation is you can afford any type of treatment. Then it's very clear cut. Go for the test first, find out which one works for you, and use the targeted, personalized one. But if it doesn't, don't lose hope. And don't say that, oh, doc, all these things that you say I cannot afford. No, 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 that's not true. When push comes to shove, there may come a time where, okay, you know what? Even though it is expensive, we have to do it now. But because we tried the less expensive way, we were just going to make a bet on it. And it turns out I'm an outlier, so no choice. But at least, you know what? You always have a real hope. You really have something that you know will still work. And I think that is very important when you fight cancer, to know that there are very still real options that are available. It's just a money issue. And, you know, sometimes with money issue, you know, God does miracles. You know, sometimes you will have unknown relative wanting to help you out, or a kind neighbor, or yeah, you just never know. But at least you know that there are options and solutions. So for this particular patient, I hope that you got very encouraged. And I think that right now what you really want to do is, can I have a consult with Dr. Jansen? Okay, and really talk about your case, because he said something to me. If I were you, I would want to know more, because he just said that chemotherapy may not have been, it's not nowadays, you know, chemotherapy may not be the first drug that you prescribe, right? It's the last drug that you prescribe. So perhaps this statement from Dr. Johnson should make you curious enough to want to meet up with him and say, hey, doc, what other drugs, what other drugs are you talking about, right? And why didn't my uncle, how shall we say, prescribe them to me? So there might be other reasons, because you didn't share your full information and we can't know. And please, for all patients that are listening to our program, right, please do not take our sharing as prescription. Okay, this is not correct, because for us to give you a prescription, we need to know your actual medical condition. So what we're doing now here is to give discussions, all right, to give you knowledge for you to understand which is the best way to go about finding out what would be the right prescription for you. So in our program, all the things that we recommend, they should not be taken as prescription. They are taken as direction for you to continue to do your research and to take action, to learn more. Then you decide. All right. So very important. So I think for this particular patient, I heard a lot of things that are very encouraging for you. You didn't want to do chemotherapy, yet you knew it will work. And then Dr. Johnson said, you know what? There might be other drugs that work even better than chemotherapy. So then you're like, oh, wow, that's even better, right? Drugs that work better than chemotherapy, but don't have the side effects of chemotherapy. And my encouraging news to you is, even if you have to use chemotherapy, we actually have the protocols to protect your body from the damage of chemotherapy. So that should allow you to be happy, confident that if you have to take chemotherapy, you're going to go through it well. You're not going to suffer the side effects. You don't need to be afraid of chemotherapy, because you have Simply Nature PPARS liquid extract there to support you. Okay, and we have done this for many patients, and Dr. Jansen is supporting, you know, so many patients like stage 4 cancer patients that are undergoing treatment and they're still doing well. Yeah, 2 years. 2 years is a long time for a person at stage 4 cancer, and it's shrinking, you see, so it's working. Okay, so there you go. I hope you are encouraged. All right, Jhen.
Yeah, sorry. I'm afraid that's all we've got time for
Yeah,
today. It's already past 9 p.m.
yeah, but
So,
today is a very lively conversation.
yeah.
Yeah,
Okay, let's wrap up this evening. We'd love to hear your final thoughts for our viewers.
Dr. Jansen.
Okay, yeah, I'll start first. No? So, if you want to know more about the tests that I just mentioned, attend the June 7 event, because there I'm going to discuss them in
Yeah,
more details.
Wow, wonderful.
In what situation do I use these tests? Yeah, so attend the June 7 event, everyone. Okay, so see you then. So I'll give the floor to Sir Shen.
All right, so I just want to say that here it is. Actually, I'm just reading more question. Maylene's question. Yeah, I just saw that. Scared of chemotherapy. It's very different from I don't want to do chemotherapy, right? So when a person says he's scared of chemotherapy, it actually means that somewhere in their heart they know chemotherapy works, but it is scary because of the side effects. So I want to leave with this, since today's topic is actually about finding hope in the middle of your cancer treatment. And you might be a viewer who is doing chemotherapy and then it's not going well for you. Not that the cancer is not shrinking, but the other side effects is too hard to bear. I want to leave with a final case study of a patient. This is actually Dr. Jimmy Katapia's patient. So as Dr. Jansen shared, it is Dr. Jimmy that actually prescribes chemotherapy. So why is Dr. Jimmy, one of the top surgeons and a doctor who uses chemotherapy, working with us and going to share the stage with us on June 7 at SMX Aura? This is the reason why. I went to see him to share with him about our products, right? And first thing I said is, I didn't go in and say, this is better than chemotherapy. No, I didn't say that. I said to Doc Jimmy, Doc, I know chemotherapy works. He looks at me like, okay, if you know it works, then how are you going to sell your products to me, right? How are you going to introduce your products to me? I repeated 3 times, Doc, I know chemotherapy works. Doc, I know chemotherapy works. Doc, I know chemotherapy works. And then Doc Jimmy, such a wonderful, honest doctor, which is why his patients like him. He said, yeah, chemotherapy works, but there are side effects. That's what he said. He was the one who said, but there are side effects. So I asked Doc Jimmy, if I can help you reduce the side effects for your patients so that they can do well with chemotherapy and not be afraid, can you give me some of your time? And at first he was only going to give me 5 minutes, but we ended up talking for like 45 minutes. And after that, we had many dinner meetings after his clinic hours where he wanted to learn more about what we did. Finally, what made Dr. Jimmy work with us is this. He had a patient he was giving chemotherapy. Her second cycle, that means the second time she take the chemotherapy, it was so terrible, so difficult for her. She felt so bad, right? That she said, no more. She was supposed to take, I think, 8 sessions. After the second one, no more. I cannot take it anymore. It's killing me, right? So Doc Jimmy at that time remember what I said. I said, Doc, if you ever have a patient that cannot take the chemotherapy, can you remember us? Because our product can help strengthen the patient and allow her to finish the chemotherapy she's on, right? So what he did is then he told the patient to go and see Mr. Emerson, who is our medical representative, and the patient used liquid extract. So 1 liquid extract a day. After 10 days, she recovered. She felt normal and better. She felt strong again. And she took the courage, okay, to give the chemotherapy another try. So she went for her 3rd session. Then her 4th, her 5th, her 6th, her 7th, her 8th. She finished the chemotherapy, and I believe right now she is in remission, because this was like 4 or 5 years ago. Okay, so there you go. You are absolutely right in your fear that yes, you are afraid of chemotherapy, and yes, some people do have serious side effects with chemotherapy. And now I'm sharing with you an actual patient with a doctor that you can meet on June 7th, all right, who was not doing well with chemotherapy. Then with our product to protect her healthy cells and her important organs from the damage of chemotherapy, she was able to benefit from the destructive power of chemotherapy on her cancer tumor. And then she did well and she beat her cancer. So there you go, right? I hope this is very encouraging I hope this will really help Ms. Maylene, because I'm sure she's still shocked having found out last week only. But if you come on June 7, you will meet many cancer survivors, all right? And they'll share with you their story, and so that you can be encouraged. And I think right now what you really want to do is arrange for a consult with Dr. Jansen. All right. And Dr. Jansen has Dr. Jimmy there. So maybe he'll tell Dr. Jimmy, hey, you should give her this medicine. And then Dr. Jimmy, yeah. So this is why we enjoy our program, and I hope we are of service to all of you. And I look forward to seeing you guys next week, and more importantly, to meet you in person on June 7th at XMX Aura. All right, it's a Saturday morning. I really like this program because I get to meet face-to-face clients and patients and their family. And we get to hear the struggles, and we also a lot of times, we help them go through the proper thinking, their thought process to come to the right decision, to help them make the right decision that is applicable to their medical condition. And like I said, I'll be accompanied on my left and right, Dr. Jansen and Dr. Jimmy. So you have a surgeon there, you have a Dr. Jansen there, and then I will be the one to support in terms of any questions for the technical part of PPARS. All right. So thank you again, and thank you for staying with us so long. I'll hand the time back to Jhen.
Okay, thank you so much to our experts, Mr. Shyan Lim and Dr. Jansen Kalalan, for sharing their expertise and insights. I can see some questions coming up, but sorry, we will answer each of them next webinar or via direct message. Now, to stay updated with our upcoming events, please like our Facebook page and subscribe to our YouTube channel to replay and share with your family and friends our very informational weekly webinars and very inspirational success stories. Also, check out our official website for exclusive promos such as number 1, get 7 free sachets of Cleansing Plus for every purchase of either PPARS Liquid or PPARS Powder Extract. So that's 1 week of detoxing worth more than 1,000 pesos. Or number 2, get a free blister of PPARS Soft Gel Capsules worth 3,700 when you buy 3 individual packs. Yeah, but wait, there's more, because on top of all the freebies, we also have a 3-day free shipping nationwide this month end, April 28, 29, and 30, with only a minimum purchase of 3,700 pesos via our official website. That's www.simplynature.asia. Next, here is the premiere of our health seminar happening on June 7, Saturday, at SMX Aura in BGC Taguig. Limited seats are available, so secure your spots now for only 200 pesos via GCash. And don't miss out on this transformative opportunity where you'll find experts from different specialties of surgical oncology, integrative and lifestyle medicine, and PPARS cancer protocol all together in one room. Yeah, but for now, I hope to see you again next week for another empowering session. Same day, same time, every Thursday night at 7:30 p.m. Next week, that's already next month, May 1, we're going to talk about innovations for breaking the cycle of chronic illnesses. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we are always with you from start to healing.